Hello everyone, this is Dr. Anjali Kumar once again bringing you greetings from Maitri. Maitri is a space where we talk anything and everything about women's health. So today's video is little different. Yesterday we put out a post at Instagram asking you people to send us your questions that you want to ask me, whether these are medical questions or personal questions or whatever. So it's just a random impromptu video. So let's see what all you have sent me. So, which college are you from? Both UG and PG. So, I am from Lady Hardinge Medical College. I did my post graduation in 1991 and I had done my MBBS in 1986. Which is the normal way of delivery, cesarean or normal? Now, this is a common question which practically every mother asks me. So, I will put it up like this. Anything which is normal obviously is better than anything which is not so normal. I'm not saying cesarean section is abnormal. In case cesarean section is indicated medically, then it is better to have a cesarean section so that you have a safe baby and a safe mother. But in case everything is going on normally, it is obviously definitely better to try for a normal delivery, because normal delivery offers a lot of advantages both for the mother and the baby. Ma'am, how do you stay healthy with impromptu night calls and emergency surgeries? How do you manage your sleep? Oh, so I guess it is in the training of a gynecologist, we are taught how to work efficiently without even sleeping. So it is in the genes of a gynecologist. Ma'am, what traveling means to you? So for all of you who don't know, I love mountains. I love to travel. I love to trek. I love to hike. So for me, if I had a chance, I would go to mountains and I just would probably stay there. So it means a lot to me. When and where did you deliver the baby for the first time? Now this is very, very interesting. So when I was in the third year. So third year is when at the beginning of third year of medical college, we are sent to labor room as a part of the clinical posting. So my first clinical posting was in the labor room, and when I entered the labor room for the first time, there was a delivery going on there. It was a breech baby, and I just fainted in the labor room, and I thought whatever might happen, I might become anything but a gynecologist, and here I am, a gynecologist. Okay, so Shruti Sarkar, 99, asks, ma'am, what would be your advice to a medical student aspiring to be a gynecologist in future? So it's a wonderful branch, Shruti, and it gives you a very nice mix of clinical and non-surgical and surgical work. Yes, of course, it is very, very demanding, but then it has its own perks. When you see a baby coming out, when you do a, successful surgery, you feel elated, and that feeling cannot be equated with anything in life. So if you're willing to put in the hard work, if you're happy with the night calls, it is a wonderful specialty to take. How to get back to pre-pregnancy weight after C-section delivery. This is Tanya Aurora 12. So, Tanya, after C-section delivery or even after normal delivery, a woman is not supposed to get fat. Remember, you would have never seen any animal becoming fat after delivery. Now, they have, of course, a normal delivery, but even after cesarean section, as a surgeon, we don't do anything inside to make you fat. So, cesarean section delivery is no excuse to put on weight. You can start, practically all kind of exercises 3 months after the cesarean section. We tell people to go for regular walks 4 to 6 weeks after the cesarean section, and after 3 months, you can practically do all kind of core exercises after C-section. So C-section is not an excuse to become fat. Can we use a menstrual cup while dancing or jumping activities? Yes, I think we did 2 videos on menstrual cup. They were quite detailed videos, and we spoke about how the menstrual cup is actually in place. It's there because of the suction. So even if you're dancing or jumping and practically doing any kind of a sport, it's perfectly all right. Swishti writes, how to approach a right gynecologist. I have heard so many cases where the doctor puts PCOD patients on a birth control pill with only to harm. So Swishti, number one, whichever doctor you go to, you need to first trust the doctor. You need to understand why the doctor is putting you on a birth control pill. By the way, birth control pills are not bad, provided they are used for a right indication, provided they are used in a right manner. They can be very, very helpful. In fact, we use birth control pills for various reasons, not just for the contraceptive purpose. They are being used for PCOD, endometriosis. I always tell this to everyone that for PCOD, the first step to treat PCOD is to take care of the lifestyle, which means that you exercise, you take care of your diet. But in case things are not coming under control and you have some issues where your doctor feels that you would be better off to be on pill for some time, then it is okay to use a birth control pill. And believe me, birth control pills, if used correctly, are not harmful. Then devilishly _ angelic. She asked, I don't know whether it is she or he, is being hairy an issue being a female? I am still thinking how to reply this question. So I would put it up like this, that being hairy can be because of various reasons. It could be constitutional, which means that there are some people who are hairy by their genetic makeup, while sometimes being hairy, or medically what we call it as hirsutism, could be the symptom of a lot of problems where there is excess of male hormones in the body, whether it is PCOD or some kind of other hormonal disorders. So in case you feel that you're being too hairy, it is important that you go to the doctor, get yourself nicely investigated, and decide then what has to be done later on. Okay, there are a lot of questions asking me, ma'am, what's your skincare routine? So the answer here is that there is no skincare routine. I don't do anything on my skin, and I don't put anything fancy on my skin, and I truly believe your skin actually reflects how healthy you are from within. So in case you are internally healthy, in case your hormones are doing well, your skin is going to show up. So again, however cliche it may sound, eating a good healthy diet, sleeping well, being positive, being happy, and exercising well will do you good everywhere, even on your skin. If you had a wish where you could change your profession, what it could be? So now, after being almost more than 33 years of my being in a medical profession, and that too almost 32, 33 years in gynecology, I actually feel so happy that I took up this profession. I actually feel happy being a gynecologist. I don't wish to change my specialty. But yes, I have very small, tiny wish which resides somewhere deep inside my heart. I used to love singing, and I still feel that I sing pretty well. I wish I could do something professionally, being a singer. But yes, now today when I see my daughter performing on stage, I really feel all my wishes have come true. So thank you very much for watching this little fun extempore impromptu video, and thank you very much for making Maitri part of your life. So please share Maitri with your friends and family, and please like, Once again, share and subscribe to Maitri, and I will see you soon.